Hello and welcome. Thank you so much for joining us today for Family Resource Centers Promoting Healthy Couple Relationships. My name is Robin Shumwell, and I will be your moderator for today's webinar. If you're joining us online, you may listen directly through your computer speakers. If you've joined via the phone number that Zoom has provided, your line has been muted to minimize background noise. And for those of you online, please note the link to the Dropbox folder in the chat. Here you'll be able to see that there's some handouts available for download. In addition, you may put questions in the question section at any time. The chat section is open for you to include any comments during the webinar, but we do ask that you direct all of your questions to the Q&A section of Zoom. Live tech support is in the room under NFSN Tech, dropping those links in the chat right now. So if you have any technical issues, please reach out to them in the chat. And to let you know that today's PowerPoint, the handouts, and a recording of this webinar will be available on the NFSN website on the Webinar Wednesday page by this time tomorrow. When you all exit the webinar, an evaluation will automatically appear on your screen. We ask that you take a moment to complete this, as it provides us with valuable feedback to inform future webinars, and we definitely do take that feedback into consideration. As I said, my name is Robin Shumwell, and I am the Membership and Events Manager for the National Family Support Network, and I will be your moderator today. So to get started, we would love to conduct a couple of polls to find out who is in the room today. So first and foremost, we're going to launch a poll that will jump right or show right up on your screen. And we would love to know, where are you joining us from? What region are you joining us from? And if you are if you're from outside of the US, feel free to drop in the chat where you are joining us from. All right, let's see those results. Okay, so we have a big representation from the South. No surprise to me, considering that our panelists are from there, and we'll get into that in a bit. All right, so great representation across the US. Now let's get into our second poll, and we would love to find out what your affiliation is. Are you from an individual FRC, perhaps a network? Or if you do not see your affiliation here up on the poll, you can let us know in the chat. Give a little bit more time here for folks to respond. All right. Awesome. So we have great representation across the board, seeing a lot of FRC participation here, and seeing in the chat that we've got a nurse case manager, so incorporating healthcare as well. Awesome. All right. And so for our final poll, we would love to know, what level do you all work at? If you're at that program or direct service level, meaning you're working directly with families in an FRC, anything. Great, let's see these results. Okay, so we've got a lot of folks, the program direct service level, again, representing those FRCs. Got good representation across the board. Well, thank you all so much for letting us get to know you a little bit. So I'd like to talk a little bit about the National Family Support Network. Over the last decade, the NFSN has quadrupled in size to now have 40 member networks in 39 states in the District of Columbia that represent more than 3,000 family resource centers that serve more than 2 million people annually. The newest members of the NFSN are Nebraska, who joined earlier this year, and Wyoming, who just joined last month. The mission of the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. The vision of the NFSN is to turn that whole map that you just saw green so that all families have access to quality family support services in their communities provided by FRCs, supported by strong networks. So for an overview of our time here today, we are going to go into an introduction of family resource centers. Then we will get into our content from our panel presenters. So we will hear from Auburn University and Safe Family Services Center in Alabama. And then we will hear from Ser Familia in their cafe in Georgia. We'll follow by a Q&A. Remember that you can put questions into the Q&A portion of Zoom at any time. And then we'll go over some resources and opportunities from the NFSN and finally close out with an evaluation. So thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as America's best kept secret. A family resource center is a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of a family resource center in Vermont, or they might be school-based, like the image that you see on the right from Kentucky. They may be in rural settings, like the image you see on the left from Colorado, or in urban settings, like the image on the right of a family resource center in the Bronx in New York City. Wherever they're based, FRCs work with families with an approach that is not only two-generational, but multi-generational, strengths-based, and family-centered. And each of these concepts is important. So for multi-generational work, you may have heard of two-generational or two-gen work. And family support is the original, not just two-gen, but multi-gen work, as programs work with children, parents, and grandparents as well. They're strengths-based because we see all families as having strengths that we want to support them to build upon. And they're family-centered because everything that we do has families at the center. Family resource centers are designed for all families, not only low income or highly challenged ones, so the support they provide is non-stigmatized, making it readily accessible. Programming is provided at no cost or low cost for participants. And the image to the right is of a Family Success Center in New Jersey. There are 57 Family Success Centers across all of the state's 21 counties. Each county has at least one, if not more, and typically more than one Family Success Center. And that includes highly affluent counties as well as highly challenged counties, because again, the belief is that all families could benefit from access to support for two of the most important roles we can have as adults, being parents and being spouses or partners. Two of the most important roles we could have for which we typically receive no support or training. Hence the value of universal access to family resource centers. So if you can let us know in the chat, how many of you have heard of the Protective Factors Framework before today? This framework comes from the Center for the Study of Social Policy, and research has shown that these 5 protective factors increase family stability, enhance child development, and reduce abuse and neglect. So as we're working with families, we want to support them to provide these protective factors because we know they make a positive difference. We can see these protective factors here present parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and social and emotional competence of children. And for more information, you can visit the Center for the Study of Social Policy website. And I see in the chat that we have a lot of folks responding that you have heard of the Strengthening Families Protective Factors before. So great to hear that, and that you know of it and that you use it. So glad to hear that. So, as conveniently located hubs, family resource centers bundle and co locate many services that may be familiar to you, such as home visiting, evidence based parenting education, health screenings, play groups, fatherhood programs, family counseling, and food banks. Despite their organic development and varied funding streams across the country, there is remarkable similarity in their most common service areas. And here on the screen, we'll see the top four based on a research funded by the Robert Wood Johnson Foundation. First, we see parenting support, which exists on a continuum from a lighter touch, a parenting workshop, to more intensive services such as home visiting. See access to resources, which also exists on a continuum from lighter touch to more intensive services. See activities focused on supporting children's healthy development. And finally, activities supporting parent leadership development, such as parent advisory committees. And FRCs not only provide programs, but build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. So now that we have had an opportunity to introduce you all to Family Resource Centers, I would like to introduce you to all of our presenters. First, we will be hearing from Rachel Odoms and Margaret Morton from Alabama, and then we will be hearing from Katie Mesa and Belisa Urbina from Georgia. So I'll turn it over to you, Rachel.
Hi, thank you so much, Robin, and thank you all for being here today to hear us talk about the importance of healthy relationships and also the importance of partnerships and how we create those. So myself and Miss Margaret, we're going to kind of tag team this presentation to give you a little bit of information about what we do as Auburn University alongside SAFE Family Resource Center. So if you guys don't mind going to the next slide, we'll jump right in. Awesome, thank you. So forming partnerships, how did we start? Where do we go? What was that kind of step one? So we took it back to the basics and we went back at the literature. And what we found was that it informed programmatic work and what to do to kind of focus on educational efforts, which turned out to be such a catalyst for federal funding of programs. So in 2003, the federal government began funding projects through the Department of Health and Human Services, as well as the Administration for Children and Families, to better support healthy marriages and relationships and demonstrate the feasibility of implementing free voluntary programs for couples. So our wonderful, amazing professor and project and program director, Dr. Francesca Adler-Bader, who is a professor in the Department of Human Development and Family Science here at Auburn University, has been leading grassroots efforts to provide services to diverse populations when the federal funding began. So she has been successful in garnering over $45 million in competitive federal funds for over 20 years now, and has continued providing and evaluating relationship education programs, not only to couples, but also to the youth across our state, as well as co-parents. So we always say to her, we're so grateful for her efforts because she has really done amazing things for the state of Alabama, but also for us personally. We have jobs and have had, these wonderful jobs for over 20 years as well. So we're really grateful for her work. This initiative is in partnership between family life educators and researchers here at Auburn University, and we have amazing implementation partners across the state of Alabama, one of them being SAFE. So I'm excited that you guys will get to hear from Ms. Margaret here soon. And since the inception of our programming and our project, we have served over 70,000 youth and adults with multi-session relationship education programming. So we're really, really proud of the lives that we've touched over the course of these years, be it adults and also youth, right? So we're just really grateful and excited about the work that we've been able to do. Okay, next slide. So this is just like a visual example of more of like who we are, who we work alongside, and kind of our dynamic, right? Like our relationship and partnership that we have. So we, the AU Central team, so us here at Auburn University, we kind of work, we're like the central designers of programming, right? So we make templates. We also offer our site scripts. We provide flyer examples. We also will create flyers for our partners. We want to do whatever we can on our end to make their lives easier, right? Because we realize that it is hard work to recruit these families and couples, and also the work that goes into providing the education. So we're kind of the central designers that guide our partners along as they go out and do this amazing work. And we also like to remind our partners and also tell others too that we are an implementation site as well, which means that we go out in our community and we recruit and we go to community events and we spread the word. And we also teach our relationship and marriage education classes here in Lee County as well. So it's like we're on the ground with you, right? So we are able to kind of talk about different issues that we may be having, different solutions that we have found that work. And we're really grateful for that. We're really grateful for our partnerships. And I think we're also proud of the support that we're able to give each other, because we tell them all the time, like, we truly could not do this work without them. And we mean that wholeheartedly. We could not do this without them. So we're so grateful for the partnerships that we have. The map that you see on the slide is just an example of the different counties that we're either in, one of the family resource centers that we're partnered with, or kind of like the spillover. So some of the counties that are next to each other, we have different couples kind of that will find out about our classes and travel a little bit to come. And I think that's what's also so wonderful about the work that we do, is that we have one goal. As all of us partners, we have one goal, and that's to get the word out to as many couples as we can. So say our classes are full, we will contact another site that may be able to offer classes or that has a spot open, because we also offer virtual classes as well. So we really do work alongside each other, and we're grateful for that. So as far as our implementation partners that you also see on the screen, they are independent, right? They're autonomous, which means they know what they're doing, right? Like, we came to them in the very beginning about this work, saying like, this is something we would love to do. It is such a need in your community. Would you be willing to provide this work? And they will, say, yes, we'll decide to have this partnership. And we kind of work alongside them, right? Like, they know what they're doing. They know what their communities need better than we do, and we trust them. And that's another reason why our partnerships work as well as they do. Feedback, we offer we welcome and we apply feedback that is given to us. And that's another thing that we're really proud of in the partnership that we have with our sites, our partnering agencies across the state, is that they can tell us, this didn't work out so well for us. Let's try this. And from there, we're all able to kind of have this conversation of adjusting to kind of meet the needs of our participants. So we hold monthly conference calls, and we're able to talk about, some do's and don'ts and maybe different things to apply. And again, we're just so very grateful for that. And we consider ourselves to be co-laborers with our partners. So we work alongside them. And to me, this is the best way to kind of say, like, we are truly partners, right? Like, we have developed a relationship. We trust each other. We are always kind of talking things out and trying to figure things out and how to best serve our communities, to make sure that we are giving them the education that they need and deserve to have, to ensure that they have healthy relationships and healthy kids as well. So I'm going to now turn it over to Miss Margaret, and she's going to talk to you a little bit about the why.
Am I on? There we go. Okay. Thank you, Robin and Rachel. And it is a tremendous opportunity to be able to talk today about an opportunity that we have been engaged with since its inception in Alabama through the Family Resource Centers, in partnership with, as Rachel so beautifully spoke to, really that bottom up, top down, being the community at the Family Resource Center level, and then at the very top level, when we began in 2003, it was through the Children's Trust Fund of Alabama. And the Children's Trust Fund of Alabama is the Child Abuse and Neglect Prevention Agency. And so that's going to bring us to the why, because the Children's Trust Fund utilized and engaged us as Family Resource Centers, sites across the state, and as well as Auburn University as the external evaluator. And so those beginning relationships have been and developed over the course of the last 20 years and have benefited and impacted in a variety of ways across the state that you're going to hear about in just a little bit, specific to SAFE, but also a part of the entire success story in Alabama of relationships. So the why would the Family Resource Center be interested in providing relationship education, and particularly marriage and relationship education? And we know in Alabama, we know that education is the key to everything. And we know that collaboration and partnerships and a strengths-based approach rather than a problem-oriented approach is what makes the greatest impact in the lives of our children and families. So as you heard from Robin, what the networks, the national networks mission is exactly what our mission is, and that's to strengthen and support families. So why are we in this work? Well, to strengthen families and positively impact in the lives of the children. We know from the research that has been done over the last 20 years that the reason why we were involved has also been the reason why we continue to be involved, because we have evidence, statistically significant evidence, that it helps individuals develop skills necessary to form and maintain healthy relationships and to promote individual physical, mental, and emotional well-being, as well as to reduce the incidence of domestic violence and other forms of abuse. And so that's the why. And we have been able to demonstrate over the last 20 years through the implementation of these programs at the community level with community and state partnerships that that's exactly what is happening through the process that we have utilized in partnership with Auburn University. And truly, as I say, it has been a partnership, and it's been a problem-solving partnership, as Rachel so beautifully stated, in terms of we are a team, we are family. We model exactly what we expect in relationships at the individual and at the family level. And so that's been the beauty and the success of the relationship education, marriage education programs that have been implemented with Auburn University and at the community level. Next slide. So how do we do this? But we have some pretty amazing, talented, and dedicated and committed individuals who actually make these programs work. And one of them actually is in the room with me right now, Ms. Linda Dixon, who has been with us for a number of years and has really grown and developed these programs. But the how we do this with Auburn University has evolved over time. We are now engaged with Auburn in an efficacy study. So for the purpose of this particular study, we follow a very prescriptive program implementation model. And I will talk a little bit about the fact that model can be imploded and utilized over other programs. They might not be involved unless they're a couple in the relationship marriage education study, but they can benefit from the tools in our toolbox for building relationships. And if there's anything that I hope you hear today is that relationship education and marriage education is key to everything we do in life. And it impacts in workforce development and everything else we're trying to accomplish, parenting education, the entire menu of opportunities that are available through the Family Resource Centers. So right now, through the efficacy study, of course, all of our classes are free and virtual. We incentivize participation. Thank you, Auburn University, because we want to value that individual's time and their efforts in learning how to follow these best practices in building their marriage relationship and their relationships in general. So the participants are there's a control group and a treatment group, and so they're randomly assigned to weekly or monthly classes. Classes are once a week for 6 weeks on Tuesdays, beginning next Tuesday. Classes are once a month for 6 months on Thursdays, beginning this next Thursday. Meal gift cards are provided for each class, and each couple can earn up to $320 for completing 4 online surveys over the course of the year. They earn a $50 Walmart card per person for completing all sessions, and classes begin at 6:30 in the evening till 8:30 in the evening. And again, you will hear over the course of this webinar about strategies for engaging those individuals in these programs. Much of that you're going to see is word of mouth and is getting out the word and building, again, and I say this, relationships. Rachel, are you going to talk about the curriculum in and of itself?
Yes, ma'am. Thank you so much, Ms. Margaret. That was a beautiful segue to talk to you about Elevate and what we offer in that curriculum. So if you have not noticed, we are fans of acronyms around here. So the curriculum that we use is called Elevate, and it is broken down here for you on our screen. And I'm just going to give you just a tidbit. This is what we call our relationship wheel. And all of our participants receive this, and it just kind of gives them a guide of what we're going to talk about in our time together, be it the 6 weeks or once a month for 6 months. But we like to just pull this out when we are telling participants who are, or just telling people in general more about our classes. They want to know, like, what kind of skills are we going to learn? So this is what I know I personally love to pull it out, because it really gives some quick little nuggets to what they will learn during their time with us. So the E for in Elevate, the first E, I should say, is all about empowering yourself. We talk about putting the oxygen mask on ourselves first, right? Like, why are we instructed to do that? Because if we're not pouring into ourselves, how are we going to pour into others, pour into our relationships, our kids, our jobs? So we talk about the importance of taking care of yourself. So eating well, exercising, managing stress, those types of things. And then we move on to the L, and that is all about laying the foundation. And this is about making intentional relationship choices, right? So your commitment to your relationship with your partner, making sure that you're finding ways to grow together, right? Like, things change and happen over time. What are we doing to make sure that we're still good, that our foundation is good, right? And then next, the second E is all about enlighten. So this is where we talk about getting to know your partner well. I mean, we have had participants in our classes that have been together a couple of weeks, all the way up to 70 years married. And that is something we absolutely love, is because they can all learn from each other, right? Like, you will come across people who've said, I've been married 50 years. There's nothing I could learn. And I love to say, well, actually, we've had, couples that were married for 70 years and they still learn something new about their partner. So this is just talking about those different things that kind of happen through life, being able to talk about your past experiences that you had together, to maybe talk like, you remember when we used to talk about doing X and we kind of, life got in the way and we haven't, kind of reconnecting. It's a lot about what enlighten is. So we would definitely love that module. Next is value. And that's all about showing affection and respect to each other. So this is one of the favorites of our participants, is when we talk about caring reactions or actions over crabby reactions or actions, right? So it's all about the delivery. Sometimes it's how you say things. So if you're saying it very loudly, I probably can't hear you as well. If I'm trying to have a serious conversation with you and you're playing on your phone or watching the TV, like it's probably not going to go over very well, right? So this is when we kind of talk about the importance of making time for each other, showing appreciation to your partner, like really expressing the value that you have for each other. And then next, we talk about attach. And this is where going back to remembering why you chose each other, like your friendship, right? Like you probably started off as friends. You did a lot of meaningful things together. You just spent time together. You had interest in each other's hobbies. And then time and life kind of happened to maybe you weren't able to do those things as often. So this is just a reminder to each other that like we're a team, right? Like we're going to approach these things head on and that we're going to figure it out together. So that's what we talk about in attach. And then we move on to tame. And tame is, for me personally, one of my favorite module, mainly because communication is everything, right? Like in our personal relationships, so in our actual intimate partner relationships, but as well as friendships, and I say family ships, but family relationships. We can have a communication breakdown. We can have arguments. We can not really hear each other. And this module is all about how to communicate in a respectful way that you can hear each other, you can respond to each other healthily. We talk about taking time out, right? So taking a break from the situation just to kind of calm down, but then being able, make sure you come back to each other to address whatever you were talking about, because it is important, to have those conversations. So this is a really wonderful module, and we talk about how it's important to be open to forgiveness as well. So that is tame. And then we move into engage. And this module is all about how it takes a village, right? Like I'm sure you can all think about the different people in your life who serve as a village, who support you and your relationship and your family, because like life is not meant to be done alone, right? So it's important to have people in your life that are very supportive of what you're doing as far as your relationship, and also what you do in the community. So we talk a lot about community resources and different things that you could do in your community. You probably personally, or you hear people say like, I want to be more involved. And we take this as an opportunity for our participants to kind of talk about like, what are you doing in the community that maybe others didn't even know existed? So we've had a lot of our partners continue a relationship after the class. They get together, they hang out, they will volunteer at different organizations and things like that. So our curriculum is really, we say it is educational. There are a lot of skills, like Ms. Margaret mentioned, for them to put in their toolbox. And we tell them too, like, these are just kind of some suggestions, right? Like this skill might not work for you, but this skill may. So we're really open with our participants, and we tell them too, like you get out of it what you put into it. So we have had so much fun implementing this curricula over the last couple of years. So it is just, and if you're interested in it, you can download the manual for free, which is also great too. So I can let you know more about that later. But for now, I'm going to send it back to Ms. Margaret, I believe. And we're going to talk about some of the services.
Yes, and thank you, Rachel. And the curriculum that she has just described for you, Elevate, is what we use and what we measure program effectiveness and outcomes with during this phase of our work with Auburn University. However, we have been armed with other opportunities through the years to be able to take this relationship marriage education opportunities to other programs at SAFE. And so I believe that Robin put up a graphic early on that really shows all the integrated resources. We call it an Alabama dinner on the grounds, where everybody brings what they're good at, but you better be prepared for it to be consumed. And so we have lots of opportunities and programs for children and families that would allow for that family to become engaged with SAFE through, for example, case management, home visitation. When I talk about workforce development, that's building human capacity. And we do a lot of the protective factors training, and also use a curriculum called Together We Can that is relationship oriented. We do a lot of emergency needs assistance with housing and utilities assistance and that sort of thing, that wraparound, as well as parenting education and support, adult education programs that tie into life skills development, and then, of course, family literacy programs. But at any entry point in any of these programs, the beauty of the relationship and marriage education programs that we have in our toolbox to support our families is that it can apply at any of level. And again, I can't emphasize enough the importance of understanding that relationships are at the heart of everything we do. So healthy relationships is important in the workforce as much as it's important in the family and on an individual level. Next slide. Some of the outcomes that have been demonstrated through these programs over the course of the time that we have been since 2003 is that we have documented data-driven support for being able to say that individuals in healthy romantic relationships tend to have lower stress levels. We measure those kinds of things. Better healthy habits, better mental health, better physical health, and greater financial well-being. And you can see how all that ties in to the work that the Family Resource Centers are doing. Is again another tool in our toolbox to strengthen and support families. The next slide, in terms of outcomes of healthy relationships and healthy children, you can see that more positive parenting, and you see their relationship and positive parenting and parenting education and support, less punitive parenting. Children in stable and high quality family situations have better academic outcomes, fewer physical health problems, lower rates of risky behaviors, and less likelihood of being victims of child maltreatment. And that is the reason, again, that is the why we do what we do and why we are always excited about having these opportunities at our fingertips to be able to provide these resources to our families. Rachel, do you want to talk about post-evaluation?
I see you,
I think
so we're near our time.
I think so.
Okay, 1 minute.
You've got a minute. Yeah, go for it.
Okay.
I'd like to tell a couple of success stories and how this has impacted in the lives of the families that we've worked with. But we have had a tremendous divorce rate issue in Talladega County where we are located. And when we started the program, we had the highest divorce rate in Talladega County. We are now 33rd out of 67 counties, made tremendous impact. We have increased participation in foster parenting. And now our curriculum actually goes through, allows us to utilize that curriculum for credit for foster parent training. So lot of opportunities and impacts that have occurred out of these opportunities that we're being able to provide our children and families through relationship education and healthy marriages. This is just another, you'll be getting these slides, just another example. We have one example I'd like to tell about is a family that joined our classes because they wanted to advance their own TikTok presentations. And so they learned that, and now they use TikTok as a way of spreading the word and recruiting and that sort of thing. Thank you, Robin. We're going to turn it over now to Belisa.
Yes, thank you so much for having me. I'm super excited to hear all that good work that is happening in Alabama and that it resonates quite a bit with what we're doing here. My name is Belisa Urbina. I am co-founder and CEO of Ser Familia. Robin, next slide, please. Ser Familia has been working in the Atlanta metro area for over 22 years. And what we do is we offer preventive family services, and we give Latinos the tools, resources, and skills they need to move from a moment of crisis to a point of being thriving again. And crisis can be defined by what you feel is a crisis in your life. We see clients that have very serious and complicated situations. There are others that might be perceived as not as complicated, but they are important to that client and that family, that participant and that family. And then obviously it's going to be important for them, and we're going to address it as such. We have 5 offices here in the Atlanta metro area, and recently we opened an office in Puerto Rico. Last year, we served more than 7,000 individuals. And for the first 19 years of our history, we did not have family resource centers. Next slide. The family resource centers, which we call them CAFES, which is an acronym in Spanish, Centro de Ayuda Familiar y Emocional, translated loosely as Family and Emotional Assistance Center, is really a cultural adaptation of the Family Resource Center model. It was developed in 2019 as a partnership with the Georgia Division of Family and Children Services to meet the needs of the Latino community. DFACS, the Department of Family and Children Services, they were concerned because normally Latino parents have a lower than average number of referrals to the agency for cases of maltreatment. So the Latino parents tend to be probably one of the lowest or the lowest among all racial and ethnic groups to be referred for cases of child abuse. But they had a lot of referrals for cases of neglect. But then what they discovered, and we discovered with the partnership from a university through a study that we conducted over 3 years of data, was that in 1 year, 0% of the cases of neglect, referrals for neglect, were substantiated. So that meant that in many of the cases, the issues were related to poverty, cultural misunderstanding, lack of knowledge of what the laws and practices here in the US were for families who were, first-generation immigrants. So there was an opportunity to implement a solution on a community-based level that will lower the number of referrals to the department. So they came to us with this idea, and then as we were putting the idea together, we discovered the family resource centers, and we realized how perfect the model was for what we had in mind. So we did all the studies, and then we decided that we were opening the first family resource center in March of 2020. Nobody thought what was coming for us, right? But we did. We opened our first FRC in March 2020, and they became the lifeline of the community. Next slide. So we started putting out there a myriad of programs. And what this cafes did was just marry with the programs that Ser Familia was already implemented in the community. What we call the Ser Familia model is for us to take a family and do a thorough assessment of everybody over the age of 12, and then prepare a plan that is very targeted, not only to the needs of the family or the deficiencies of the family, is really covering those for sure, but then talking about their dreams, their goals, what is it that you want to achieve? But then there were always these gaps that we needed to provide in order to really involve the family into this network of support. So the family resource centers became our welcoming mat to the community. Now families know that we do from those very involved programs to more programs that cover more of their immediate needs. During the pandemic, we did a lot of food access. Many of our families were doing hours of lines in food banks, and they were denied food because they didn't have a Georgia ID. So we became the lifeline for that. We have given since the beginning of the pandemic more than $4 million in rental assistance through our FRCs. And we started to do it much more as a way of really supporting those families. Next slide. So we have been involved in couples programs since the beginning. Actually, Ser Familia started as a couples programs inside of a church. My husband and I are originally from Puerto Rico, and after going through a tough time in our marriage, we went back in our island to a project that helped us. So we became volunteers there. So when we moved to Georgia in 1999, we were looking for opportunities of continuing to do couples work as volunteers to remind ourselves of the things that we have learned and also guide other couples. And we discovered that they were not available. So then we started very organically in our church doing that with volunteers that came along. But as the years went by, we started giving it structure to what is now Ser Familia, which is the largest Latino organization here in the state of Georgia. We continue to do that. Original Couples Workshop is a one-day workshop in which couples learn skills. It's mainly communication skills. And it talks about, all of those little details that sometimes we forget as couples, as, the relationship develops. And it's very rich. It has been implemented in Puerto Rico for over 40 years. So we brought those skills here to Georgia. Then we added a program developed by the University of Denver. It's called A Nuestro Alcance. In English, is Within Our Reach. And it's really a couples program that is delivered along 8 weeks. There are 17 different modules. So the presenter has the ability of configuring the class and using those modules that he or she feels that are going to be more pertinent to the group or are going to be more useful. So these programs are going to be combined with other programs and services as the case managers within Ser Familia create individual family plans for each family. Next slide. So why do we invest in this work? Why this is important? Because first of all, couples work has been central to our efforts. Our programming has evolved over time, but in reality, we always feel that this is the core of Ser Familia. Now we have 14 different programs and services, but really we always have felt that programs for couples are, the center of what we do. Because in reality, we feel that these couples are just the center of our communities and societies. Also, programs for couples are almost non-existent in our area, and even more so if they are in Spanish. Also, another thing is that sometimes these programs are very difficult to fund, and you find less opportunities for funding, and we're going to talk about that in a second, for couples programs that you do for other type of programming related to families. But in reality, at the end of the day, we all know that children whose parents have a healthy relationship are going to be at less risk for abuse. They're going to experience greater stability, and they're going to have better outcomes in life in general. It doesn't mean that obviously single parents cannot do a phenomenal work, and it is not discounting that. But if you have a couple in the house and you empower them to have a healthy relationship, the kids are going to greatly benefit by that. So really, the CAFE model, the Family Resource Centers, have really helped us bring this type of programming into the community even more. Next slide. So what are the outcomes? About 88% of the couples who participate in the programming feel that they have more effective ways of communicating to one another. About 87% of the couples who complete A Nuestro Alcance, they state that they feel more committed to their relationship. And commitment, we all know that is so important to make sure that their relationship flourishes. About 90% of the couples who complete services with our agency feel that that their family situation is better because of the services that Ser Familia provided. So in the words of one of the participants, this program has helped me better understand myself and my relationship. It has helped me create a better relationship with my wife. And I chose that one in particular because it comes from a man. Sometimes we feel like men are going to be less prone to participate, which is not necessarily true. We were talking, if you make the program, friendly, if you make it, we were talking about making it lighthearted, put a little bit of humor in it, then everybody's going to feel at ease. And maybe on that first day, they're going to be a little bit hesitant, but then by the second week, they're going to come, willingly, and they're going to form great relationships among, the different participants. Also, when you have these couples programs as part of a bigger project for the family or a bigger plan for the family, is great, because then you can pull from the different components of that plan to really add up to the family's toolbox. So next slide. How do we get funding for this? The initial cafe funding for the cafe, as I shared, came from the Georgia Division of Family and Children's Services, and to this day, they continue to provide funding for the program. So the second side, I shared that Ser Familia has 5 offices. Out of those 5 offices, 4 of them have cafes currently, and there's one, our main office, that we just received the funding, so we are building the cafe as we speak. So the second side was funded by a large private foundation here in Georgia, which is the Joseph B. Whitehead Foundation. Other sources of funding that we have used, last year we received a congressional appropriation that helped us open the 3rd cafe, then at the south of the city, and it came straight from Congress, from our 2 senators. So also, the largest community foundation in Georgia, an American Rescue Plan Act money, ARPA money, helped us open that 4th one. So we have been working on sustainability. Ser Familia is big on that. Our Latino families in Atlanta, they do not have a lot of programs and resources. So we always make sure that if we're going to start an effort, we have all the pieces and all the plans ready to make them sustainable. So from the beginning, they started with one funding source, but now we are actually putting other pieces in place so that is more diverse. There's some diversification of the funding of each of the cafes. So, these programs have been, as I shared, steadily growing from a very grassroots effort to becoming, a much larger and robust program here in Georgia. I think what is very important is that families sees us as a resource. We work with one of the most under-resourced communities in the state of Georgia, which is Latinos. Some of our clients might not be documented. Many of the families that we serve might be, a mixed status family. And we are ready to always make plans and find opportunities for them so that we can serve them in a manner that makes sense. All of our staff, we have staff of 46 right now. Everybody in our office that interacts with the client is bilingual. And everybody is a native Spanish speaker. We feel that that's important because our clients need to feel identified with the people that are providing services to them. Also, sometimes in a moment of crisis, in a moment of need, a person is going to revert to their native language, even though they might be fluent on a second language. So I think those are details that we can take into account as we plan for services. Another thing that we are big on is creating places that are welcoming. Usually when our families walk into our spaces, they always say that they feel like, oh, this is so welcoming, it feels so warm. it goes from everything that we do, from the color that we have the walls, you know, the type of colors that we use, to all of it.
This meeting is being recorded.
To make it very, very welcoming to them. I think that we have gained through the years that trust, and it really makes it very important for us. Next slide. So I want to introduce Katie Mesa. Katie and her husband Jesus participated on our couples program over 17 years ago. So we have known each other for many, many years, and they have participated, I guess, in almost every program that Ser Familia has to offer. So she's very ingrained in our, you know, model of services and what we do. And also they have been volunteers of our programs for many years, certainly over 15 years. So I want Katie to share a little bit about her story and how Ser Familia and the Family Resource Centers have benefited her. And then, you know, at the end, I'll share a couple of ideas to close up. Katie?
Hey everybody, thank you so much. It's a pleasure to be here and to put it from my experience and my husband's experience how amazing this organization is and the way that they impact my life and the life that the people that I loved. I came in to Ser Familia 17 years ago just because I was trying to get married by church, and the father at that time told us that we had to go to a 12-hour retreat, not knowing that that retreat will change my life forever. I was with the idea that, you know, family was the center of the society, not knowing that the center of the, you know, all of this is couples, husbands, married and wife. I mean, husband and wife. So, like Belisa was saying, when I got into that great opportunity to see everybody just talking from their perspective, from their marriage, about communication, about sex, about um, finances, about the difficult situations that we go through life, then I realized, hey, this is actually really good. We need to put the word out there that there is this institution that is actually helping us to understand a little bit about ourselves, our culture, and definitely to thrive and do what is best for our marriage. So far to say that back then I used to live in Fayetteville. For those who live in Georgia, I used to live in Fayetteville, and I was all the way from Fayetteville to Suwanee just to make sure that on Saturdays I was in the retreat with the Ser Familia people.
Yeah. So thank you so much, Katie. It has been certainly a pleasure to have you and Jesus as volunteers for so many years. And it's always wonderful to hear how the work that we do impacts other couples. So something that I wanted to draw from what you said is, like, in our programs, everyone is welcome. Katie mentioned that you know, that couples are center of the home and of the society, which is absolutely true. And Ser Familia tries to always be, you know, and like a home for everybody. We call them that we have a home for our familias, and so everybody is welcome. Our couples workshops, especially the original couples workshop, is more geared to the traditional, if we can call it traditional, but more of a man and woman type of relationship. But then a Nuestro Alcance has the openness and the ability, we were sharing that, of being pivoted. So we have, you know, sometimes single parents. We have had certainly couples, same-sex couples, that have participated on the programs, and they are welcome. So we just want to make sure that there's an opportunity for everybody that wants to improve their relationship, to feel better and to feel also connected to one another, so that we can create healthy environments, which is at the end of the day what we are striving for. Something that I think it was interesting because Katie also mentioned, how she and Jesus got to our project. They got because the priest at their church sent them as part of their premarital education, and I'm sure they scratched their heads and went like, what in the world is he thinking? But we get referrals from everywhere. We get it from, certainly churches, we get them from DFACs, we get them from schools, so many places that sends us those referrals. And something interesting has been that after the pandemic, we have doubled the number of referrals that we get. Before the pandemic, usually we used to get about 100 referrals per month. Now we are over 200 referrals per month. And what we do is that we try to contact every referral in 24 hours. So it has become really a very monumental task to make sure that we are there, staying on top of all the different families that are requesting our services. And that's one of the areas where we certainly, there is an area of tremendous need, is to replicate the model that we are doing, because in some areas, there's barely no services in Spanish in the areas of, as I shared already, couples work, and also in areas of mental health. We are sometimes the only provider in Spanish in that county, and Georgia, the Latino population in Georgia has increased tremendously. Georgia is the state of the United States where Latinos are growing at a faster rate proportionally to the population. So there's an opportunity, and that's the reason why we open an office in Puerto Rico, is really to create a model in which this could be replicated in other areas of the state and hopefully in other states. So in the end, the next slide. Here is, our information. You can, if you guys want to connect with us, we're always happy to reach out and see if there's opportunities for collaboration, and also share any of the ideas that we have gained through the years. Thank you.
Thank you so much, Belisa and Katie. So now we are going to turn to a discussion with the full panel, and we would like to present some lessons learned from the journeys that SAFE Family Services Center and Ser Familia Cafes have had. And so we're going to start with this first bullet, which is where acknowledging that participants are in a vulnerable setting and preparing ahead of time for them to feel included and comfortable. We're going to kick this question off, or with this bullet item off, with Rachel. Or I'm sorry, Belisa, I apologize.
Yeah, we have to, yes, it's very true. Usually people come to you not knowing what to expect. So they're going to be a little bit nervous, a little bit hesitant. So always to make sure that you are creating a welcoming environment. Some of the things that we use, one of them is, good humor. We try to make, make it lighthearted without taking it from the seriousness of the topic and the importance of what we're discussing. But I think that people appreciate and feel more at ease, as if they get there and it doesn't feel that stuffy. So this is something that has always served us very well. I think also that, as I shared before, that the participants can always identify with the presenters, because maybe they're Latino, or maybe they are speaking Spanish, or whatever it is. You always can find a way of making that person identify with you, making yourself accessible and closer to that individual that is coming for services.
Wonderful, thank you. And Margaret, do you want to take us into the next bullet point?
Sure. This is dealing with how we incorporate relationship education at the Family Resource Center into other program opportunities. And I think I mentioned that before, that by virtue of the mission of the Family Resource Center to strengthen and support families and relationships. You know, we could superimpose relationship education across everything and across everything we do, and we try to do that within the Family Resource Center. It really is at the foundation of what we are able to provide. But in our case, because we have been involved in relationship education and marriage education for a number of years, we have a lot of tools in our toolbox. So where we mentioned the Elevate curriculum for the efficacy study with Auburn University, we have been trained in other curriculums, the Strengthening Families Framework, which is the protective factors, which deals with relationships and that sort of thing, as well as the Together We Can, which again is geared more toward that individual who may or may not be in a relationship. They may be, but they're not married. And so that gives us other opportunities to bring in those resources that will make it a universal opportunity. You know, there's no wrong door.
And then, Belisa, did you want to add on to that at all from your perspective?
Yes, what Margaret is sharing is very important. What Ser Familia has done, since we have several different curriculums, we not necessarily incorporate pieces of this curriculum into other services, but we more create those family plans in which we incorporate different services for a family. So the family plan for family A is going to look vastly maybe different from the family plan for family B, because it's really very much targeted to the needs and dreams of that particular family and the individuals that make up that family. Because the idea is to help each of the individuals, making personal improvements, but as they are doing that together, they're also impacting, the actual system, the family itself. So we always, not all of the people that get the information from us or come to us for services, are going to be necessarily married couples or people that are living in a relationship. There's going to be a lot of single parents, and then we're going to adapt to that. And as I share, the A Nuestro Alcance material can be pivoted to be shown in a way that is called A Mi Alcance, within my reach, which is geared towards individuals as opposed to couples.
And I'd like to add to that. I think that's exactly right and true. And in our case, as we view relationship and marriage education from a prevention lens, then when we are providing these kinds of opportunities with school-age children, for example, we are building that prevention continuum. And these relationship education opportunities, we have found through anecdotal data and that they really have prevented negative outcomes at the individual and at the family level.
Absolutely. Thank you both. And then Margaret, did you want to take us into the bullet point about self-assessments and your recommendation for when to conduct those?
Yeah, and it's based on lessons learned and opportunities that we've had, once again, to engage in evaluation and assessment of our programs and how we can make that inform what directions and what adjustments that we need to make. But what we found over the course of time was that many times when we would do a pre-test and a post-test to determine whether or not a person had gained knowledge or had changed behaviors or whatever the assessment was designed to measure, that many times we were seeing regression. So we began to look more closely in terms of why would that be? Here we've done this pre-test and they're ranking themselves at a much higher level than post-test. And so what we began to realize through a lot of investigation is that you don't know what you don't know. So if I'm coming in and I'm in an unhealthy relationship, I may be in an abusive relationship, and that's all I know, I might not understand that is what's happening. So when I have the education, I realize then I may have ranked myself at a 5, but really on the front end, I was a 2, and now I'm really at a 3. So we discovered that we had to do things a little bit differently. And one of the ways we addressed that was to do retrospective surveys so that they're given pre-post at the end compared to what you knew before. What have you learned, or how have your behaviors changed, or whatever it is you're trying to measure. So it was a process of really looking at what does the data inform? What is the data really telling you?
Thank you. And so for our panel of presenters now, we are going to cover some suggestions that you all have for getting started for FRCs and other family support programs that are interested in starting this work. And we've heard why this work is so valuable and what the outcomes are and these positive outcomes. So now if our panel can lead us through your suggestions for how to get started in this work.
Thank you, Robin. I'll just start on this first bullet point about integrating information within classes that you already offer. So we like to say, and I'm sure you guys have heard it before too, FRCs are a one-stop shop, right? Like, so you have people coming in for all different types of needs and different resources. So it's a great opportunity to talk through what you offer as a site to kind of cross recruit. So I love that a lot of our participants that we talk to at our other agencies, they've taken the parenting class. They've also had assistance finding a job. They've also done some like workforce development. So they've been able to have all of these different offerings and resources just by coming through the door for one specific need and then being offered all these other things. So recruit at home, right? Like I say at home because, you know, most of the time we're at work more than we are at our own house. So you kind of start there. So with the people that you have and their different needs, just kind of cross recruit. And we've learned that that is very effective. Anyone else want to hop on that before I go to the next point? Don't want to, okay. And then looking for evidence-based programming. So, and what does that mean, right? So essentially having participants complete surveys so we can go back and analyze them for us to really figure out, does this program work? Are we seeing change over time? And is the change going in the right direction? So trying to find curricula that is evidence-based. And it's important too, because we know how funding is, you know, things are expensive. Look for some low-cost curricula, or some are even free. I mentioned earlier our curriculum that we use, Elevate. It is, you can download it for free, or you can purchase the actual manual for low cost. So while I think it's an awesome resource, and it being free just really adds to that. So as you're getting started, try and find those curricula that are evidence-based, but also really offer great information to your participants.
Yeah, Rachel, if may I add, sometimes what I have seen is that, you know, people that, or organizations that serve Latinos or other, you know, cultural, you know, groups or groups that speak another language, they are sometimes a little bit hesitant to use evidence-based programming. And it has served us so well, especially when it comes to securing funding, because it's much easier to secure funding if you're using an evidence-based. And there are so many evidence-based programs that have been not only translated, but acculturated and proven into those different groups. We have found a myriad of great programming that has been tested and proven with Latino audiences. And they have served us so well because they also gives you consistency. It's going to be the same class, the same material. Doesn't matter who teaches the material, is going to be exactly, or more or less exactly, the same information being put out there.
Absolutely. I'm so glad you mentioned that. And like we kind of talked about in a part of our presentation, that feedback is very important to us. So feedback from our participants and also our partner sites is the need for a Spanish workbook and translated manual as well. So in our next funding cycle, we have already made connections to do that. We will hire translators to come to our class because we really don't want to have any barriers for people to attend. We've also had had a deaf couple attend our class, and they got on virtual, and we had a translator still kind of translate the classes for us. So it's there. We just have to do a little bit of work, but it's worth it, right? So I'm glad that you mentioned that, Felicia, for sure. Just to kind of keep going, our next point about changing up how you offer your classes. We have in the past done workshops. We have realized that it can be a little easier sometimes to have a couple come on a Friday evening and then half a day on Saturday to receive program versus asking them to come once a week for 6 weeks or once a month for 6 months. Change it up, right? Like our needs are different, and we know that personally. The spring is typically a little bit busier with sports and things kind of going on. The summer is a little harder with travels and kids being out of school. So, think about that as you're planning when to hold classes and different things. So we have found that it is effective to offer either workshops, but once a week and once a month also works too, for different people. So again, finding out the needs of your community is kind of where to start there. So, Felicia,
I agree with that. And I think one of the most important pieces of this is that, of course, depending on what, how you're funded and what the expectation of the funder is and what the expectation of the study is, there's adherence to fidelity of the program, and everybody has to be doing the same thing if we're going to legitimately evaluate it. But on the flip side of that too is that in giving these participants an opportunity to be in an environment that is conducive to their culture and conducive to their learning styles. And so we've had great success when we've taken the programs out into the community and engaged the faith-based community and making it a special event, a meal and a gathering and decorations and things of that nature that really bring people into that. Some that have not been very successful in a school environment don't want to come and sit in a desk and be lectured to. And so I think we have to be ever sensitive to how we deliver that is culturally appropriate as well as fun and engaging.
Mm-hmm. And I think that in that same regard, you have to take into account when the classes are delivered. In our cases, most of them are going to be in the evenings and are going to be on the weekends.
Yeah.
And we want to make sure, that there might be in a different setting, depending on the community that you're serving. It might be at the Family Resource Center, but you might partner with a church. And if the majority of people are participants of that church, maybe it's there, maybe it's not the church, it's the school. So having that flexibility is always important. And then going into informing staff and presenters that they don't need to talk about their own stories. It might be very useful if they do, but also you want to make sure that they don't feel forced to do it. What we have found, through the years is that it helps quite a bit when you're allowing yourself to be vulnerable and to a point and allow other people to see you as a person, as somebody sharing their same struggles. But also the presenters have to have that ability to set up whatever boundaries they feel comfortable with. So we don't need to push them in either direction. Also,
training is a key to that. I think that you can't just, you may have some wonderful volunteers, but those volunteers and those staff members must be trained so that they can respond in appropriate and healthy way when situations arise between the couples. And so there's a critical piece that training plays in all of this if you're going to legitimately offer and get the result that you want, rather than creating more challenge and adversity with the couple.
Correct.
And,
so
learning how much you should share, how much shouldn't you share, how the program is to be delivered.
Correct. And also the individuals that come to get services, they need to know who they are talking to. In our case, where we have clinicians, because we do mental health counseling, and people who are not clinicians, we even have an attorney that does immigration services for our victims of domestic violence. So there are so many people in our office that fulfill different roles. We are always very cognizant in making sure that they know who is it that I'm talking. I am not a counselor. I have zero training in that regard. So whenever, if I am leading a couples program, I'm going to be the first one to say, I am not a counselor. I am doing all of those disclaimers so they do know. And maybe we have a pediatrician who is a volunteer. He always says, I'm here not as a pediatrician, but as a dad and a grandparent. So that is important. And there are many agencies that put that in their flyers and recruitment materials. And that's a very good idea, that, you know, the course is really, you know, educational and not therapy. And then adding that additional layer of making sure that people know who's speaking, you know, and in what capacity they are talking. And, you know, prepare the participants on what to expect. All agencies do this in a different manner. In our case, usually families come into our center and we complete since we do a more thorough programming, you know, they complete some forms that go from the assessments that allow us to create the plans. But also we always do a participation contract. And this is something interesting because all of our services are free of charge and we can do a lot for a family. But then we ask them to commit to participating. We want them to be engaged. And that's the only thing that we're asking from them. Obviously, there's no way that you can really force them to participate, but we try to really make them excited and try to visualize the positive changes that their family is going to experience as the result of their commitment. And also during that time, we let them know what to expect from our physical space. We even let them know where the emergency exits are, as simple as that, to much more, you know, complex. You know, you're going to expect a call from your case manager, you know, every 2 weeks. All of those details, they're going to know beforehand, and they're going to go home with a form explaining all of that. We're going to send then a text confirming all of the information. And always they have a way of getting back to us, either via email, via phone, or via that same text system, so that there's always an open line of communication.
Thank you so much. So we will move into the Q&A portion of our time together today, and would encourage folks to go ahead and put any questions that you may have into the Q&A portion of Zoom. And I wanted to kick this off, and you all have spoken a little bit about it, but I would like to know your perspective. You've talked a little bit about counseling and really making all participants aware of who is a counselor, who might not be a counselor. But what would you say to folks who might have a fear that by offering this type of programming that people will perceive it as counseling, or that it'll turn into marital counseling? How do you deal with that in your centers, and what would you say to folks that have kind of that hesitation in terms of offering this programming?
I think that I can speak from SAFE's perspective and from the Family Resource Center perspective in Alabama, and that is that Family Resource Centers, as a general rule, are looked at more from a perspective of family support. They aren't viewed as a like they may have mental health counselors there, they may have marriage counselors, but it's more of when the family comes in the door, it's not coming for treatment. It's not a treatment perspective, and we don't bill it that way. I mentioned early on in my comments that, you know, we know that education is the key to everything, and education is education is education. And that's what we're doing. And so that in and of itself is the brand. So we don't experience those kinds of issues with people being fearful to come to our programs because they think we're going to try to put them in therapy, or that there's a mark on their back that I mean, it's come one, come all, and they're from all different walks of life, particularly those that are in our relationship education, marriage education programs specifically. So it's sort of the neighbor next door, and the neighbor next door is not going to do treatment with me. And we have partners that we refer to if that's a situation that an individual finds themselves in.
Yeah. In our case, we have not found a lot of people that have that hesitancy. Normally, the groups like a Nuestro Alcance or all of those couples programs are not delivered by counselors, and they, participants know that. And it turns usually more like into a group that, gets together, and there's a relationship that is shared in there. So things are, whatever they feel comfortable talking about is talked about. So they understand more that informal setting. And from the beginning, they do know that if in the end, they, along with their case managers, they determine that they will benefit from individual counseling. We do not do couples counseling. So that's something that they know from the get-go. If they need counseling, it's going to be individual counseling. That is going to be a different process. They have to agree to that. That will be talked about. They have to fill out, some other forms that are needed. So I think that the expectations are clear from the beginning.
Absolutely. Thank you so much for answering that question. And I see that Rachel answered one as well already for us. So at this time, I would love to say thank you to our wonderful panel of presenters, to Margaret, Rachel, Belisa, and to Katie for presenting this wonderful information. So thankful to have been able to highlight your programs and your work with healthy couples relationships during this webinar. So thank you all. So now, before we end our time together, would love to take just a short amount of time to share with you some information that we have going, some resources available with the NFSN. First of all, on the series of Webinar Wednesdays, our next upcoming webinar is going to be on November 1st, and that is focusing on the implementation of the standards of quality for family strengthening and support in Hawaii. So we will have the Hawaii Family Support, Ohana Support Network present then. Then we also have certification trainings for the standards of quality for family strengthening and support. They're offered the 4th Thursday and Friday of each month, and the next offering that is open will be in November, and you can register on our website for that. The NFSN also offers a training on developing and sustaining effective parent advisory committees, and that is co-trained by the NFSN staff and an experienced national parent leader. That next offering will happen at the end of November, and again, you can register on the NFSN website. There are tons of resources available for free on the NFSN website, including overviews of family resource centers, videos, research reports, systems level funding information, and the full Webinar Wednesday library. There is a great possibility that if you are interested in a specific topic with family resource centers, if you're wondering how family resource centers work with teen parents, how they engage fathers, how they work with community schools or co-locate with healthcare resources, there's a good chance that those might be available in our Webinar Wednesday library. So I very much encourage you to visit that. We also have the Family Resource Center Learning Hub, and this hub is designed to provide tools and sample materials for those who are seeking to develop individual family resource centers. The hub is organized into the 6 phases of developing a new family resource center, each with accompanying resources. And after you register via the webpage, accessing all the materials is completely free. The NFSN offers various services, including facilitating connections with NFSN member networks. Again, we have them in 39 states and DC. We present for key stakeholders, including education leaders, child welfare leaders, children's trust funds, and all about the work with and investing in family resource centers. We also provide technical assistance for family resource center network development and provide the trainings that were just mentioned. My contact information is here on the screen. Would love to dialogue with you more and hear from you with any questions that you may have or information that you would like to share. And finally, I would like to remind you that there will be an evaluation that will pop up on your screen in just a moment. I would ask that you kindly take a few moments to fill out the evaluation, which includes questions about identifying your next steps and what would support you with this work. And we do read all of those evaluations, all of those comments, and incorporate it into our work. So thank you all so much for your time today. We're just so glad that you joined us. Thank you to our wonderful panel of presenters, and we look forward to seeing you next time.